Assalamu alaikum and hello. I am Faryal and you're watching New Wave Global. Pakistan is one of the only two countries alongside Afghanistan where polio is still endemic. As this year that witnessed a surge in polio cases draws to an end, the total tally of polio cases in the country stands at 64, with virus detected in at least 83 districts, figures that are a far cry from only one reported case in the year 2021. Balochistan is the most affected province this year with 26 cases, 18 reported from Khyber Pakhtunkhwa and another 18 from Sindh, and one each from Punjab and Islamabad. Polio is a highly contagious viral disease affecting children under the age of 5, causing paralysis and, in severe cases, death. Prime Minister Shehbaz Sharif launched this year's fourth and last polio vaccination campaign on December 15 amid intelligence reports of security threats to the drive that aims to reach more than 44.7 million children. I'm extremely grateful to the industrialist and humanitarian who's very much a part of this campaign and has been a part of all previous polio drives. He has dedicated his life and resources to eradicating polio from Pakistan, Mr. Aziz Memon. He's the chairman of the National Polio Plus Committee, Pakistan for Rotary International, and has been awarded the Pride of Performance for his great efforts for various causes. Mr. Memon, thank you very much for making time for me.
Thank you very much, Faryal. As you did mention about um, pride of performance, so you may also like to add that Sitare Imtiaz also was given to me.
All right, great. That's great. Thank you for adding that in. So I would like to start off by asking why we are witnessing this recent surge in cases after having almost eradicated polio. The cases have gone up from only 6 reported last year to now 64 and counting. Seems like the gains that Pakistan made since in 2021, they have been somewhat reversed. What do you think is the one major factor which has contributed
Uh,
to this resurgence?
you see, Faryal, till we have not eradicated, till we have not eradicated polio or any other disease, the outbreaks are going to happen. This is the track cycle of the disease. We are not exception. Now, we came to a point where Pakistan passed 14 and a half months without a single case
Hmm.
and without a single positive sample. And we were on our way to march forward to complete the 3 years certification cycle, which has now been reduced to 2 years. So, what went wrong? Where did we go wrong? There was, a small political refusal in one of the uh, towns of southern KP, and very small population, very small children under the age of 5. And we got first 3 cases from there. And then the march started and we came to a point, 7 cases from southern KP. A southern KP 21 was southern KP plan was made to contain the virus in southern KP. It doesn't happen that way because southern KP is not an independent country. There is a mass movement, migration right from Afghanistan, from Peshawar, from southern KP to Karachi, passing through the whole of Pakistan. So we could not contain the virus in that area.
Hmm. So,
Afghanistan recent changes and the steps taken by the Taliban regime, starting from stopping the female workers. Then step two was that even the United Nations female workers were not allowed to work. Then the main thing was that we do house to house campaign. Without that, it is not possible. So they had allowed us, I'm talking a whole of the world, they had allowed us in Afghanistan to do house to house campaign except Kandahar.
hmm.
All of a sudden, their religious leaders overturned that and they said, no, it will not be house to house, it will be mosque to mosque. Now that is a very challenging thing. How can it be possible when the teams go to the house, they find it difficult to give the OPV. So then you are asking the mothers and fathers to bring them to the mosque.
Hmm.
But then we found something in between, that street to street they come to some point and have the children vaccinated. But this is also not doable. We will need to have house to house campaign. The virus, on both sides, we have the same epidemiological block. Come what may, both countries will have to stop circulation at one time.
Hmm.
The 2,400 kilometer of porous border, is open, and the people have been going from one part to another for centuries, for no reason or rhyme. You can't stop them. Sometimes we close the border, sometimes we ask for visas, sometimes, but it doesn't help. They will continue doing that.
So on December 16, Chief Minister Murad Ali Shah, he launched the immunization drive in Sindh as part of the current countrywide campaign of the polio eradication program, which is targeting almost 45 million children. And you, as the PNPPC national chair, are working closely with it. Now, that's not an easy target. Almost, we are talking here about 45 million children. So, should we expect to meet the inoculation target of this last drive of 2024, considering that an estimated 500,000 children, they missed their polio vaccination during November's inoculation drive?
You see, 45 million is not the target of Murad Ali Shah, it's the target of Prime
Yeah,
Minister
I know.
Shahbaz Sharif,
It's the
who is
overall.
leading,
Yeah.
it's nationwide. And Shahbaz Sharif, Prime Minister, is leading the campaign from the front. We are thankful to him, we are proud of him. Rotary got involved. We were the first to get involved in polio eradication when we started with a small campaign 44 years back from Philippines. And after that, WHO and WHO, UNICEF joined us. It became the GPEI, Global Partnership. And then others have joined it, BMGF, Bill Melinda Gates Foundation, Gavi, all that. Rotary has put in so far, out of their own resources, $2.7 billion, B as in boy. When we started, it was 125 countries which had virus. Now two are left with wild polio, and then we have some countries in Africa where we have the derived cases, for which a new vaccine is soon coming up. So we are, and the global partnership is committed, committed to finish the job. We had 3 weeks back the polio oversight board meeting in which I also participated. It is chaired by the Bill Melinda Gates Foundation chair, Chris Elias. We have the WHO UNICEF director, and we went to all provinces. We saw all the shortcomings, and we made the recommendation as to how we should take the campaign forward. The cases have reached 64, I agree with you, but there could be some more cases also before we take a U-turn and settle down. But now the virus the is coming down, and the vaccine are reaching the children. So the environment samples which are showing positive are also showing the presence of vaccine inside. That means the children are getting it.
Hmm.
We had a round of fractional dose of OPV and IPV. This was very, very effective, and it had the household coverage of 95% plus. The two rounds of that will be done in the 85 super high risk um, UCs of Karachi, and similarly selected UCs of Quetta and Peshawar, because these are the reservoirs.
So,
So we
coming to the security situation, unfortunately, on the very first day of the drive, on December 16, a constable escorting the polio workers in Karak, KP, was martyred and one vaccinator was wounded. And in another attack in Bannu, a gunman shot and wounded a police officer assigned to escort polio workers, which of course reminds us that polio campaigns survive amid a highly deteriorating security situation. Many lives are lost. There are attacks on security personnel. And does the National Emergency Action Plan for polio for the year 2024-25 prioritize a comprehensive security slash surveillance strategy for the safekeeping of polio workers and security officials? Because also the current chaos in Afghanistan, as you yourself just mentioned in the beginning, will perhaps lead to more terrorist attacks on the polio vaccinators.
see, whenever, like I just mentioned to you, POB, and I was continuing on that. One of the, other than meeting the Prime Minister, we spent time in GHQ. We have a ongoing dialogue with the General Headquarters. We interact from the CNC down the line. And even in the National Emergency Operations Center, we have a brigadier sitting dedicated by GHQ to do the monitoring of the rounds. The security and killing of the vaccinators and policemen is sad. It's
Hmm.
bad. It, other than the lives lost, it immediately sends a wrong message to everyone, discouraging messages. And this gives a wrong media image nationally and internationally. We hope that this will stop. And we hope that other than the polio, now when I was mentioning about the fractional dose, we want to target improving the routine immunization. Today in Punjab, you have the very good routine immunization, but not the best, but better than the other provinces. We need to improve the routine immunization because the majority of the wild polio cases show zero routine. Malnutrition is also another threat. Malnutrition and stunted growth, the children having got the vaccine were declared wild polio cases because they were suffering from malnutrition. The case of Jalalabad yesterday is
Yes.
a 14-year-old child.
Hmm.
Now, the 14-year-old child got the last OPV drop when he was 5. That means 9 years back. The child in Sakhar, 3 weeks back, was 11 years old. So we are looking into strategies as to how to address this. On part of Rotary, as I mentioned to you, other than giving $2.7 billion worldwide, we have contributed $500 million in Pakistan. We provide cold chain. We have set up resource centers. We have set up permanent transit points. We do health camps. We have put up water filtration plants all over We do religious leaders workshops. We just finished one in Hyderabad. We are planning end of this month in Peshawar, followed by Multan. So we are doing advocacy. All the 4,000 Rotarians in Pakistan are engaged, helping to get to house, door to door, and creating an atmosphere in which the vaccine is acceptable, and telling the parents also that this is not a harmful thing. The harmful thing would be avoiding it,
Hmm.
and the best way is to take it.
Yeah. So, just a few figures on this, on the lives lost. At least 200 polio field workers and scores of security officials accompanying
Sad.
these polio
Sad.
have been killed by armed groups since 1990s. And Balochistan accounts for 41% of the total polio cases, which correlates as an area where security challenges are most pressing. The inability to conduct door-to-door vaccination safely in these regions has certainly led to virus targeting children and hindering national eradication efforts. So, Mr. Memon, there are also reports of the polio vaccination campaign in Balochistan being postponed. The latest drive, it has been postponed in Balochistan after health workers boycotted it to oppose a proposed hospitals privatization plan. They are demanding that the government should stop its plan to privatize state-run hospitals where they work. Now, has the drive really been postponed in Balochistan? And what has really caused the postponement, since that's a big blow to this drive, considering that Balochistan is the most affected province?
Faryal, as a matter of fact, um, at one time, we saw chronic refusals. Chronic refusals means no is no. Now, that refuse, I'll tell you just one small story. About 7 years back in Quetta, a taxi driver's son was affected by polio. And there was another child in the home. I was told by my team that they are not giving the drop to the other child also.
Hmm.
He was a taxi driver. I went to his home. It was a Jugi. I sat with him, requested him. Very soon, he said that I have no objections. Go ahead, give him. Now, I have no objection. Give him in my presence. We were so happy. But then he said, but I have one condition. We said, what is the condition? He took out a revolver and kept it on the table. He said, first shoot me and then give him. So these were the sort of chronic refusal. Those days have gone. Now
Uh,
the refusals have taken a turn. That there is no water, there is no electricity, the
Sorry,
roads are bad.
I'm
You
really
are
sorry.
privatizing the hospital, this reason, that reason. But postponing campaign for 2 weeks in Balochistan is a setback. But
Hmm.
then the teams were not prepared also to carry out this important last campaign of this year, for which more preparation was needed. Hence, the chief secretary decided that we need to postpone it by 2 weeks, and we endorsed it.
So this was
So
the
we hope that we will be able to make up on that.
due to the lack of preparedness
Yes.
that it has been postponed and not what has been reported.
No, no, those, Faryal, are the reasons also. But
Hmm. Maybe
the
it's a group of
important
reasons.
was that we need to be prepared also for it. No?
Hmm. Hmm.
Because if you would just go ahead haphazardly, the results would not be good, and the missing children will be too many. You have been mentioning about the missing children. Yes, they are a challenge.
Hmm.
We need to target the missed children, and especially in the when we do the mop up blast round, it is targeted to go and find the missed children. Well, the missed children have gone; they have not disappeared. We need to get them, and we need to uh, give them the vaccine. OPV is a challenge, but we need to continue with OPV till the virus is gone. IPV has a better acceptability. We do 2 rounds of that, and we do fractional dose also. This IPV builds up the immunity within the child. Within the child, it is very good, but OPV needs to continue till we have stopped the circulation.
Yes. Coming back to what you mentioned in the beginning, how things become challenging from the other side of the border when we talk of Afghanistan, and there has also been talk of initiating a synchronized campaign with Afghanistan, which is crucial to target polio on both sides of the border, like you just mentioned. And there was supposed to be a talk in the first week of December in Doha with the World Health Organization in this regard as well. And I am really not sure if those talks were held or not. But considering that polio campaigns are random in Taliban, with Taliban authorities abruptly halting the door-to-door vaccination in many areas, and in Kandahar, as you also mentioned, due to Afghan authorities' concerns about surveillance activities in those areas, because I think most of their leadership is also living in Kandahar. Will it be easy to synchronize polio drives with de facto Taliban government? Also considering that security threats from that very country across the border disrupt our own polio drives as well. Do you think there's a chance we can ever have these synchronized campaigns with Afghanistan?
Faryal, some years back, we used to have the synchronized campaign, starting the NIDs in both part of Pakistan, Afghanistan, having border meeting, having UC to UC meeting. But then, with the changes which come up in Afghanistan, up and down, things change. Today, we have definitely a new government in Afghanistan. We have a bigger challenge. And I always keep on saying that we need to have better regional peace and harmony to conquer diseases like polio, meningitis, measles. We need to live in harmony and we need to live in peace. We hope that we are able to cultivate that and bring peace for betterment of our children. Now, one more thing, Faryal, they have stopped sending children the girls to the schools.
Yes.
Our biggest challenge is that the female literacy is in these parts where the cases are is very, very low. If the mother is literate, she will ensure that the child is vaccinated. The
Hmm.
mother will ensure that the child goes to school. Both the things are missing. Primary literacy and primary healthcare go hand in hand, and it gets connected to the female literacy. So when you educate a female, you educate the whole nation. So we need to look into this also, that how and when, whether you are looking at Kila Abdullah or you're looking at Bajood, the female literacy is low, the routine immunization is low, the polio cases are more. So
Hmm.
it all collectively amounts to one big numbers coming up, and then looking at it that there has been an outbreak. Before we move forward, one more thing I want to mention to you, that every 5 years, when we go in for election, we are one of the British parliamentary setup countries where we have a terminology called caretaker setup, where everything is changed from the prime minister to the deputy commissioner to everyone. And we go into a caretaker mode for 3 months, 4 months, 5 months. Sometimes it goes on to 6 months. The new government, when elected, take few months to come back to address important areas like health. So virus which is volatile, which
Hmm.
is vibrant, cannot tolerate this gap of 9 to 10 months. Now, if you look at it,
Absolutely.
if you take the graph of last 15 years, you always will see that during the caretaker setup, it had now it mean these things don't result instantly.
Hmm.
The gaps created during those days show that eruption come up after that. We are suffering from that one. So maybe at one point of time, the leaders and the political leaders who are listening to you, we can tell them that, look here, we need to strengthen our election control system. We need to strengthen the position of Chief Election Commissioner, and we need to do away with this something called caretaker setup.
Yes.
Because this creating a gap, now the gap is just not
Hmm.
Shahbaz Sharif handing over to Khattak. No, it
Yes, and
continues
that does
down the
affect a
line.
lot of other areas as well of working here.
Yeah,
So,
a
Mr.
deputy commissioner, this, that.
Memon,
So, everyone is that goes to zero.
if you
Then
could
how
just
can anyone become
very
hero?
briefly, Mr. Memon, answer this question. The frontline field workers, they often are known to complain of low pays, there are salary delays, and there are tough working conditions that they have to work in. And there are lots of polio survivors also who are on these campaign teams. Allegedly, they do not receive help with transport or they don't receive health benefits despite their conditions. They have to sometimes walk in extreme weather and tough terrains. Now, there's lack of pay parity, it is said, if we so especially compare it with international organizations who are associated with this eradication program like the WHO and UNICEF. Obviously, those workers are paid much better. Do you think the polio workers are being paid sufficiently, or the government needs to address this issue of low remuneration? Very briefly.
Faria, looking into our not internationally, looking into the national statistics, they are paid fairly. They are compensated fairly. The money is also now transferred to them instantly. So that delay is also gone. And from time to time, their wages, their remuneration is reviewed according to the cost of living index. So this is not a very fair attack that they are not paid fairly.
So how much
Now,
are they
coming,
paid? Is it something like 1,400 rupees per day? From what I know, uh, do you have any idea how much they are paid?
yeah,
Like,
actually it depends whether they are in case of CBVs or mobile team, every one gets a different amount.
Mhm,
And when you are doing an NID, you are taking into account 400,000 frontline workers, huge. And
mhm,
if you look into the security and the government employees put into this job, you're looking into putting 500,000 people on the workforce. It's a
mhm,
big job,
mhm,
and it needs to be appreciated that the government of Pakistan, the provincial governments, they are fully committed. We have a prime minister who is leading the campaign from the front line. We have all four chief ministers, all four chief secretaries who are very much engaged. Now it's our turn to turn around and take down the numbers of this, make good campaigns, and then the missed children numbers will go down, and the affected wild polio cases also will come down. Now, another question was the polio survivors. See, polio survivors don't go along in these campaigns. We
all
have special program for them. We have like in Karachi, Rotary Club of Karachi has got a rehabilitation center. We do provide them all sort of help and needs whatever they want. So this way, there is one in Lahore also, in Islamabad also. We take care of that. And we hope that we are able to do more for them.
Hmm. All right. So polio is preventable, and the failure to control it is, of course, not merely a health crisis, but rather a broader indicator of systemic inefficiencies and misplaced priorities, sometimes public health mismanagement. And of course, it's a reflection of the performance of successive governments. The worrying reality, however, is, as Mr. Memon also mentioned earlier, that there are likely a far greater number of asymptomatic or mildly symptomatic infections that go undetected every year. Pakistan administers more than 300 million doses of the oral polio vaccine annually. So the question to ask here is why the disease still comes back to plague us. Mr. Memon, I thank you very much for sharing your expertise and your valuable perspectives with us. Till next time, Allah Hafiz and goodbye.